is defined by binge eating disorder. Binge eating disorder is a serious eating disorder in which a person frequently consumes unusually large amounts of food and feel unable to stop eating. It is characterized by recurrent episodes of binge eating in the absence of regular compensatory behavior such as vomiting or laxative abuse. Binge eating disorder can develop in various types of people, from younger age to older age people. It is also common among people with type 1 and type 2 diabetes. The distress of having diabetes, which requires a constant focus on weight and food control, may be the reason for this link. For some people, painful childhood experience such as family problems and receiving critical comments regarding weight and body links to developing BED. Moreover, researchers identified a genetic component, meaning that BED could also run within a family.
Symptoms of binge eating. Binge eating episodes typically associated with 3 or more symptoms to identify binge eating disorder. Therefore, you have to have at least 3 to meet the criteria. The first one is eating an unusually large amount of food, and they tend to eat frequently for over a 2-hour period. Next, uncontrollable feelings about their eating. They will feel depressed, disgusted, ashamed, and very guilty of themselves after overeating. Last but not least, eating alone because of being embarrassed by how much one is eating. They will feel very shameful and eating by themselves.
There are 3 recommended ways to diagnose binge eating, which are physical exam, diagnostic tests, and physiological evaluation. For a physical exam, this may entail taking your height and weight, as well as evaluating your vital signs including heart rate, blood pressure, and temperature. For a diagnostic test, include blood, urine, and other laboratory procedures. This is because to rule out physical illness as the cause of the symptoms. This test may also reveal medical consequences of an eating disorder. Things that discussed with therapists or mental health specialists, which is feelings, ideas, and eating pattern. Other than that, a psychological self-report questionnaire may also be required of you. This is because to diagnose and treat mental illnesses, psychiatrists and psychologists use a specially designed interview and assessment tools to evaluate whether you have binge eating disorder.
Treatment of binge eating disorder. The goals for binge eating disorder are to achieve healthy eating habits and reduce eating binge. Binge eating is so closely linked to shame, low self-esteem, and other negative feelings. Treatment may also address this, as well as any underlying mental health disorders like depression. You can learn to feel more in control of your food by seeking therapy for binge eating. Psychotherapy, Cognitive Behavioral Therapy, CBT. CBT may help you cope better with issues that can trigger binge eating episodes, such as negative feelings about your body or a depressed mood. It may also give you a better sense of control over your behavior and help you regulate eating patterns.
The second one is interpersonal psychotherapy. This sort of treatment focuses on your interpersonal relationship. The goal is to develop your interpersonal skills, which refers to how you interact with others such as family, friends, and co-workers. This could aid in the reduction of binge eating, which is often prompted by strained relationship and poor communication skill. The third one is Dialectical behavior therapy. This type of treatment can help you learn behavioral skills to help you cope with stress, regulate your emotion, and enhance your interpersonal relationship, all of which can help you avoid binge eating.
There are also things that you can do that will help you control or prevent binge eating. Number 1. Recognize when you are hungry. Sometimes people binge eat when they get over hungry, so you should learn to recognize your hunger cues and focus on eating a healthy meal or snack before you reach the point of being over hungry. Number 2. Focus on your food. Don't eat when you are distracted by television program, movie, book, or other activity. So you need to turn off your device and keep mealtime a separate activity. Number 3. Get enough sleep. Sleep plays a vital role in regulating hunger and appetite. A lack of sleep can increase feelings of stress and low mood, which may trigger binge eating.